In the speaking role play, you have tasks given to you and a general introduction about the patient, about his or her condition, which forms part of the role play. Let's take a look at what we have here. You will be given 3 minutes to prepare and 5 minutes to perform the role play for each question. You see the daughter of a 70-year-old woman who does not like to have blood tests, and her daughter wants to know why the blood test is important and why it is required to be done. Here are the tasks one by one. Give reasons of blood test. Check general status of health, liver, kidney functions, and impact of the medication. Explain blood tests are part of the routine health check. Explain the greater risk of bruising in older patients. Explain details of the fasting requirements. Explain the need for a GP appointment. And finally, recommend the son or daughter's involvement. Let's start the role play. Hello, good morning. My name is John, and I'm one of the registered nurses working in this clinic. What brings you here today, ma'am?
Good morning, nurse. I am here to understand more about blood tests. My mother takes a blood test frequently as per her doctor's advice. However, I don't really understand why does she require so much of blood tests.
Okay, I understand your concern, ma'am. Don't worry. I'm here to help you. How may I address you, ma'am?
You can call me Julie.
Thank you, Miss Julie. Let me explain the importance of blood test. Before moving ahead, can I ask you a few questions regarding your mother?
Yes, nurse, please. She has been diabetic and hypertensive for the last 15 years. She has been on medication for it.
Okay, Miss Julie. First of all, blood tests are used to measure or examine cells, chemicals, proteins, or other substances in the blood. We normally do blood tests in order to understand the general health of a patient and also to understand more about the liver and kidneys and to check if they are functioning well. As you told me that your mother is taking medication nowadays. Therefore, this blood test reveals if there is any impact on her current medications. So based on the result, we can change the medicines if necessary. Do not be overly concerned. It's generally a part of routine health checkups like blood pressure and cognitive function test. I hope you are with me, Miss Julie.
Yes, nurse. I understand the importance of blood tests. However, my mother does not like pricking or piercing using the needle to take blood samples as it causes her pain and bruising after every blood test. What can we do it to manage?
I appreciate your concerns regarding your mother. As you know that your mother is 70 years old, the bruises are something very common in elderly people. It happens because their skin is very sensitive and veins become less pronounced. But you don't have to be worried because it is harmless and fades away quickly. Apart from that, if your mother experiences some sort of pain, you can ask her to take paracetamol for pain relief after consulting with the doctor. Do you have any concerns that I could address, Miss Jolie?
Yes, nurse. I came to know that there are some requirements before the blood test. Can you please tell me a bit more?
I acknowledge your concerns, Miss Julie. Yes, there are some fasting requirements before the blood test. That is, your mother is not allowed to take food for at least 8 hours. However, she can continue drinking water and medications as usual. I hope you are following me, Miss Julie. Then the interlocutor may agree with that by nodding of her head, and the nurse continues by saying, it is a good idea to take your mother for blood test in the morning itself, so that she does not have to go for lengthy fasting. Are you following me, Julie?
Yes, nurse. I have a better idea now. Thank you very much for helping me with the right explanation. Your guidance is highly appreciated.
That was a reasonable question, Miss Julie. It is better to make an appointment with a GP so that you can discuss the result with him and review her current medication. Along with that, you can plan for her further treatment. Okay, Miss Julie. In addition to that, it is highly important to accompany your mother during the test and the follow up appointment with her GP. That will really help her to boost her confidence level. Moreover, she will become more comfortable as she requires physical and emotional support. Okay, I forgot to ask you, will there be anybody accompanying her during the blood test and follow-up appointment?
Sure, nurse. I'll be with her always. Thank you.
I really appreciate you for that. Do you have any more questions for me, Miss Julie?
No, nurse. Thank you so much for your valuable suggestions.
You can now close the role play if the interlocutor does not have any more questions. Here is how I would conclude. So far, we have been discussing the blood test and its importance. I hope I have clarified all your concerns and queries. If you have any more questions or concerns, you can contact me anytime. I will be glad to assist you. Thank you, Miss Julie. I wish you a wonderful day.